Hi, my name is Sarah Marcion, and I currently attend Grand Canyon University. I'm doing this project about my strategic plan at my organization for the course Leadership 620. The strategic plan that I'm currently doing is implementation of family-centered rounds and bedside report. The goal is to improve patient engagement through implementation of family-centered rounds and bedside report. The objectives: define family-centered rounds, describe bedside report, describe the stakeholders, identify the benefits, and define the process, evaluation, and recognition. Before I get started, I want you to take a moment and to think about, have you had a parent, a child, family member, or friend at the hospital and wish there was some way that you could get up-to-date information, or the family can get up-to-date information about the patient, either being more involved in the plan of care as well? This is what family-centered rounds entails. Family-centered rounds is where the members of the interprofessional team will meet daily in the patient's room to discuss the plan of care, the patient's progress, about medications and resources required during and after discharge with the patient and/or the caregiver. The interprofessional team entails the primary nurse, physician or nurse practitioner, the pharmacist, the social worker, and care manager. And if the primary nurse is unavailable, then the charge nurse will attend. Bedside report. That entails for the nurse to nurse performing shift report at the patient's bedside to discuss what we call the SBAR, situation, background, assessment, and reconciliation. This promotes patient and caregiver engagement and involvement. This does by contributing to the patient information. The parents or the caregiver or the patient can ask questions or have insight about the plan of care. Who are the stakeholders? The stakeholders entail the patient, the caregiver, the clinical nurse, the physician or nurse practitioner, the social worker, the care manager, the pharmacist, and the nurse leader. How does family-centered rounds and bedside report benefit the patient, caregiver, or the interprofessional team? It improves patient engagement and team collaboration. It enhances patient safety, promote positive patient outcomes and experience, and determine plan of care for both the nurse, patient, and caregiver. The plan effectively for resources required after admission or discharge, and reduce errors, example medication errors or any other sentinel or adverse events, and also reduces the length of stay that usually costs a lot for the patient. What are the strengths? The strengths are current process for rounds and shift report. Service residents or nurse practitioners are always on the unit. Interprofessional or interdisciplinary team, they currently attend rounds in the conference room. The weaknesses: there is no accountability for physician or nurse practitioners to attend the current rounds. Patient or caregivers are not part of the rounds. Patient or caregivers are not able to hear real-time updates, and also they have inconsistencies with end of shift report between nurses. What are the opportunities? Incorporating patient and caregiver into interprofessional rounds, which will be called family-centered rounds. Streamline the process for end of shift report to involve the patient or family in bedside shift report, and patient and caregiver engage in the plan of care. The threats: physician availability between clinic visits to round, prolonged time spent at the bedside, nurse unavailable during family-centered rounds. And here's what we could do to help make this an effective process. Each unit will conduct daily family-centered rounds with the primary nurse, social worker, the pharmacist, caregiver, physician, or nurse practitioner. Each service team, that means physicians, will collaborate with the unit, nurse and leadership, and charge nurses to agree upon a time that they will conduct family-centered rounds. The only thing is they need to conduct these rounds before 1 p.m. 1 p.m. is the highest times for discharge, and physicians are required and needed to write discharge orders. Each nurse will perform bedside report at the patient's bedside. Unless the patient is over 18 years of age or caregiver opts out and would not like to participate in family-centered rounds or bedside report. To have knowledge of the patient or caregiver to see if they would like to participate in family-centered rounds or bedside report related to this, they will be asked the question during the admission process to the unit. The patient or caregiver are entitled to opt in and out if they wish. What will the education or training consist of? There will be multiple live 2-hour sessions to attend, class to provide resources. The first hour, it will be for learning your role in family-centered rounds and bedside report. And the second hour relates to performing simulations, including dealing with barriers effectively. For example, caregivers are not available or you spend a lot of time in the patient's room, or if a caregiver keeps opting in and out, what are your other resources? And frontline staff will have the opportunity to be trained and become a champion. This is a wonderful opportunity. With it, we definitely have to have an evaluation process to make sure what are the best practices and opportunities for improvement. Nurse leaders will conduct a round daily to get feedback from parents or caregivers in addition to patients. Champions will seek the peer feedback to the nurse and leadership team and will give that feedback to the nurse and leadership team. A survey will be sent to staff and within 90 days from the go live to get feedback about best practices, barriers, and opportunities for improvement. We'll also be doing scorecards displayed on each unit to evaluate patient satisfaction, average length of stay, and discharge delays. In addition to that, it will also be discussed at staff meetings, huddles, shared governance councils as well, so we could get real-time feedback for improvement or to see how the process is going. Recognition. Leaders will write weekly thank you cards to staff for them to get recognized. In addition to that, when staff is inconsistent with the process, through feedback, or when staff is consistent with the process, through the feedback from the patient, caregivers, peers, or members of the interprofessional team, they will receive a gift card. Also, if a staff member is recognized more frequently than any other staff, they will receive a gift certificate. And right now we currently do self-scheduling, so there will be no changes made in the finalized schedule. And they will also be named Staff of the Month for Family-Centered Rounds and Bedside Report. In addition to, if your unit goes or meets the patient satisfaction score for the month, your unit will have a team celebration event. So implementation. What would you expect when it will be implemented? This will be implemented within 90 days from today, February 1st, 2017. What will occur in the next 30 days? You'll have education and training for all staff and champions. In the next 60 days, there will be a pilot on 2 units prior to going live organizational wide. And in 90 days, come February 1st, 2017, we'll go live with family-centered rounds and bedside report. Responsibility and accountability. Everyone will have to sign up for education and training, and that's the stakeholders. Leaders following up with staff who do not attend training and sending this information to the executive team and also the service chiefs. The expectation is to have 100% completion rate per each unit. Ensure there is an accountability with an attendance sheet during each family-centered round and bedside report. Nursing leaders provide the attendance update, again, to the executive team and to the service chiefs. Do you have any questions?